day everyone, my name is Carter Jr. and today I will be performing preparing a medication for vials and ampules and also performing for intramuscular. So now I will be checking the doctor's order. So firstly, we must check the doctor's order to ensure that the patient receives the right medication and the right time. So next, checks the medication administration record or MAR. So check the medication administration record or MAR for drug name and dosage frequency, route of administration, and operation date for administering the medication. So next, I will check the label of the medication carefully against the MR to make sure that the correct medication is being prepared. And then I will follow the 3 check of administering medication. I will read the label of the medication first, and then when it is taken from the medication card, and then before withdrawing the medication, and after withdrawing the medication. So now I will organize the equipment. So now, first, I will be performing a hygiene because it is to save the time and reduces the chance of error. And now, I will prepare the medication file for the drug withdrawal. So that's after that, I will mix the solution if necessary by rotating the vial between the palms of the hands, not by shaking. Because some vials contains aqueous solutions which settle when they strand. Shaking is contraindicated because it may cause the mixture to fall. Sorry. Sorry for having spent a lot of time doing this. Then I will go here. And then we will remove the protective cup. So prior to the procedure, since I already performed a hand hygiene and hand washing, now I already put my gloves on. So prior to performing a procedure, introduces myself and verify the client's identity using agency protocol. So now Um, my name is Parenteral Jr. and today I will be your student nurse. And for your comfort and privacy, I already closed the doors and closed the curtains. And also assist the clients to a position in which the arm, leg, or abdomen can be realized depending on the site. As agency protocol indicates, to clean the site with an antiseptic swab, start at the center of the site and clean in a widening circle to about 5 cm to 2 inches. Allow the area to dry thoroughly. Then place and hold the swab between the third and fourth finger of the non-dominant hand, or position the swab on the client's skin above the intended on the side. And then I will prepare the syringe for injection. And then I will remove the needle cap while waiting for the antiseptic to dry. Pull the cap straight off to avoid contaminating the needle by the outside edge of the cap. And then I will inject the medication. So grasp the syringe in your dominant hand by holding it between your thumb and finger, with palm facing of the side and upward for a 45 angle insertion, or with the palm downward for a 90-degree angle insertion. Prepare to inject. Using the non-dominant hand, pinch for the spread of the skin at the side and insert the needle using dominant hand and a firm steady push. When the needle is inserted, move your non-dominant hand to the end of the plunger. Some nurses find it easier to move the non-dominant hand to the barrel of the syringe and the non-dominant hand to the end of the plunger. And then inject the medication by holding the syringe steady and depressing the plunger with a slow, even pressure. And then I will remove the needle. And then remove the needle smoothly, pulling along the line of the insertion while depressing the skin of your non-dominant hand. And then, if bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. Dispose of the supply appropriately. Assist the patients into a comfortable position. Flip down the medication ticket if not using the MR. Reminder: if there is no blood, there's no blood, as you can see when I inject the medication. So I will inject it directly. So now I will be preparing the medication. And then perform a hand hygiene. And then select locate and cleanse the site. Select a site free of skin lesions, tenderness, swelling, hardness, or localized inflammation, and one that has not been used frequently. If injections are to be frequent, alternate sites and avoid using the same site twice in a row. So I will locate the exact site for the injection, and since I've already put my hand gloves, this will be my site injections. So now, I will clean the site with an antiseptic swab using a circular motion. Start at the center and move outward about 5 cm or 2 inches. And then transfer and hold the swab between the third and fourth finger. And then, using my non-dominant hand and in the readiness for the needle withdrawal, or position the swab with the client's skin above the intended site. So now I will prepare my syringe and uncup it. That's fine. Then, if using a propalgin anti-dose medication, take caution to avoid dripping medication on the needle prior to the injection. If this does occur, wipe the medication of the needle with sterile. Since I am done wiping that, now I will be injecting the medication using the Z-trunk technique. So now uses the ulnar side of the non-dominant hand to pull the skin approximately 2 to 5 cm or 1 inch to the side. under some circumstances, such as for an emaciated client or an infant, the muzzle may be pinched. I will now hold the syringe between the thumb and forefinger as if holding a pen, piercing the skin quickly and smoothly at a 90 degree, and then holds the barrel of the syringe steady with your non-dominant hand, and then aspirate by pulling back on the plunger with your non-dominant hand and aspirate for 10 seconds running. If blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. If blood does not appear, inject the medication steadily and slow, approximately 10 seconds, and withdraw the needle. So after I withdraw the needle smoothly at the same angle of insertions as you can see, and then apply gentle pressure at the site with a dry sponge. Now it is not necessary to massage the area at the site of the injection. If bleeding occurs, apply pressure with a dry sterile gauze until it stops, and then activates the needle safety device or discard an occupied needle and attach the syringe to the proper receptacle, and then remove and discard gloves and perform a hand hygiene. Then, document all the relevant information, the time of administration, drug name, dose, route, and the client reaction, and then assess the effectiveness of the medication at the time it is expected to act. And thank you for watching.